Welcome to Psychologist Talks. On today's episode, I've got a bone to pick with our profession. Imagine that. I've got several bones to pick with our profession. But in this case, I'm going to talk about two forms of therapy that I think are irresponsible to practice, if not dangerous to practice. The names that I've given them, which I'm sure is not unique or novel, I'm sure other people have come up with similar names, are basically, on the one hand, friend therapy, on the other hand, validation therapy. I'm going to go through each of those, describe what it is and why I believe it to be dangerous. So let's do friend therapy first. Now, friend therapy, I think, has existed as long as the profession has existed. What is friend therapy? What it sounds like? Basically, the therapist becomes a friend. Now, I practice a relational psychodynamic model, and I will say I build intimacy and what could look like or sound like a friendship with my patients. I care very deeply for the people that I do see. And some, indeed, I could very much imagine being friends with. However, that does not absolve me of the duty of objectivity, frankness, and directness. That's just part of my style. And that I offer more than just simply listening and dishing out advice. That's not my role. It is far greater than that. So my bone to pick with friend therapy is not the fact that there is something that could resemble a friendship. It is that it is merely a friendship. That is all it is. Our job is not to replace the friendships that we have in the real world. Now, what is friendship therapy? What does it constitute? Well, I think what friendship therapists do essentially is one of two things, or both of them. And that's one, they listen. Now, that's incredibly important. I mean, it's foundational to our field. The power of listening is not to be understated. To be seen, to be heard, to be witnessed is no small thing, and it is a very powerful thing that we provide people. The idea, though, is it's not just about listening. You're not just sitting there and going, wow, okay, how'd that make you feel? Wow. And it's, again, fundamental building blocks. We do a little bit of that, but it needs to lead somewhere. There needs to be some sort of theoretical direction towards which you are heading as a provider, or your provider is heading, besides passive or, active listening, I guess you could say, too. I don't want to make it sound like, you're just sitting there, eyes glazed over as a provider. But that's one of two things that's happening. That's it. Listening. Number two is the action portion, I think, of friend therapy, and that's dishing out advice. Now, once again, there's a fine line here. Us providers, we do, in a way, provide advice. We guide people, though, I think is the greater kind of notion, is we sort of lead people towards places, or we go with them to where they're heading to help them better make a decision for themselves. What often happens in friend therapy is the provider inserts their own judgments and inserts their own sort of beliefs on what should happen. Now, what's really challenging is us psychodynamic folks sometimes poke and prod very directly and say, what's that about? Or this seems really unhealthy. But in friend therapy, it's like, that person is toxic for you. You should leave that relationship. You know what I think you should do? And it's essentially what some friends do. I mean, some friends are wise enough not to just tell people what to do, because I don't think that's often very helpful unless really somebody needs a push. But it crosses this boundary as a provider where we're just acting as a replacement for what a friend might serve. Where we can go to a friend and say, all this bad stuff's happening, I don't know what to do, and the friend goes, I don't know, I feel like you should just ditch him. And that's the beauty of friendship. We could just be blah. And we could just, and if we trust, don't just take my advice and do it. We can just offer and be like, that person sounds horrible. I don't know what to do with that. A therapist needs to be more objective than that and say well, I don't know. That doesn't sound healthy. You seem very upset by that. What's your understanding of this? So we have to be more delicate. We don't just jump into dispensing advice or labeling things for people. We kind of, again, guide. So the friend therapy, I think, is the lesser of the two when it comes to dangers, because there are generally positive aspects. But, when people are with bad friend therapists, they're basically being led by the therapist in a very unethical, very unhealthy way. The more benign version, which I think is more common, is you'll talk to folks who have seen these types of providers, and they just talk about capping out on them. They're like, I don't know, they listen a lot, but I don't feel like I'm really getting anywhere. Now, some people love their friend therapists. They will, talk all day about like how they get coffee together and it's like having a best friend and all this other stuff, which should be a big red flag for a lot of folks. But I think most people eventually, people seeing these providers get tired of it because they start to realize, like, what am I doing here? Why? I just feel stagnant and stuck, and they just affirm a lot and then they tell me what to do. But I keep finding myself in similar problems because they're not actually doing therapeutic work. They're not actually doing therapeutic work. So that's friend therapy. Again, I think very commonplace. But please remember, being friendly with and having a relationship with a client is not inherently a bad thing. It is about, though, the boundaries and the frame and sort of how you navigate the relationship that is of utmost importance. Certain providers just absolve themselves of the relational aspects because that makes it so much easier to not do this. Whereas those of us who are a little bit more process-oriented, even feminist therapy, feminist-based theory, is very kind of personal. But even that has intentionality around it that friend therapy simply does not. So that's number one. Number two is validation therapy. Now this is a particular bone to pick. I hear a little bit less about this, and I think it's a little bit of a newer wave thing. As validation goes down, as stigma has gone down, simultaneously there's this idea of like hearing people's truths. Like whatever somebody's experience is their truth. Now, this kind of adage or notion by itself is not a bad thing because our internal experience is our own personal truth. It's indeed true. If I can line up, I love given this little notion, I can line up 10 people. If you're the one person who sees it differently, it doesn't mean you're objectively horribly wrong. You have your own perception, and it's reasonable to honor that perception. But what validation therapists do is they take that too far, where it's basically the role of therapy is just to validate and encourage people at all costs. They see something as traumatic, it's traumatic. They see somebody as abusive, that person is objectively abusive. That person, hurt their feelings, and that person's a jerk. And it doesn't matter what it is, it's the truth. Now, this might work 50% of the time because a lot of people self-steer relatively well in life. They really do. They have their own internal working model of like this ebb and flow of like, what is my responsibility? What is other people's responsibility? And they find their own way. So having a validation therapist is not a bad thing because they'll validate the experience. But the patient will internally counterbalance themselves. The challenge, though, is there's a lot of people who do not do that for themselves. And there's a lot of people who even weaponize this in very dangerous ways. And then there's even more who are just ignorant to their internal experiences. Personality issues are notorious for this. If you provide merely validation therapy to a personality disorder, it will get worse. I mean, maybe it'll stay the same, but it ain't getting better outside of the random luck passage of time. Now, this might sound callous or mean and be like, so what, you're just supposed to punch patients in the face? Not literally, but just like punch them in the face with negative feedback and disregard their experiences and just be like, no, I know better. No, that's not what I'm saying. Even the relational psychodynamic approach, the one that I take, says like, look, people are indeed the experts on them, and we need to honor what people's internal experiences in. But like most things, it is about a balance. That we are also tuning forks that are listening and can identify things that might not be in the awareness of the patient, of you, the person coming to see us as providers. And it behooves us to offer, if not, it doesn't even just behoove us, it is essential for us to offer these things eventually, to say like, you keep saying this one thing, but I keep detecting this other thing. Now, I'm not, bludgeoning people and saying you're wrong and I'm right. But a validation therapist doesn't go there. They're like, well, if that's the way they want to believe it, I'm sure this person is horrible. And, I'm sure this is, whatever. What's really bad is usually validation therapists also don't manage their countertransference terribly well. So whatever their personal belief systems are just get injected right into the therapeutic room, which once again is dangerous. Either creates groupthink or can actually invalidate the other person's position because they think so differently and they're just hell-bent on their own kind of agenda. So that's kind of the validation therapist. Their goal inadvertently is just to basically make sure that the person feels good about themselves, which, is part of what we do. We want people to believe in themselves. But I think any really good therapy challenges us. It challenges us as a human being. And once again, this is not a provider who simply just inserts themselves and insults and aggrieves and causes a lot of pain with their patient. Rather, it's one that can balance validation with confrontation. And that's an essential part of this field. Why do I say validation therapy is so dangerous? I think it entitles people to, I kind of already alluded to it, they stay stuck. They stay stuck. If anything, they will double down on unhealthy ways of relating to themselves and others because they now can point to a therapist who's validated their position. It can destroy relationships, it destroys groups, it can destroy societies if we just endlessly validate and never challenge people towards perhaps, maybe, alternative perspectives or more balanced perspectives on how things work. And once again, personality disorders incredibly dangerous. So yeah, those I think are the two that give me the most grief and very disappointing to hear about. I will provide a quick caveat, and this goes out to providers. There are absolutely times that when somebody transfers or they're starting up therapy again and they come to see you, that they might talk about their prior therapist through this lens. And it indeed could very well be true. But it would not be my first rodeo that people kind of oversimplify what a prior provider has done. Now, why does this happen? Now, I don't think it's because the person is malicious and just like talking down about their prior therapist or even like exalting them for doing friend therapy or validation therapy. People will, one, sometimes hear what they want to hear. Or number two, what we often lack in the field is really helping our patients conceptualize what we're doing with them. Like, I'm a huge proponent that at any given point, somebody should know generally what I'm doing with them. They're not the psychologist, right? They're not the provider in the room. I don't expect them to be. But very frequently, transparently, I'm talking about a change journey for them. This is where I think we're at. Where do you think we're at? So that we're kind of getting meta about it, or phrase off and say we telescope out periodically and go, where are we at and what have we been doing? And that way they're actually internalizing all the complex work that's happening within the therapy room so that, if they transfer or if they end an episode of care and start a new one later, they can look back and they have kind of a working model for what was being done. So indeed, sometimes the therapist was a friend therapist or a validation therapist, but very, very, periodically you will get people who just don't know how to talk about therapy, and it will sound like the therapist was just doing these things. But many times they were doing much more. Maybe not tons more, but it is very possible they were doing more than what is being passed on to you. So a quick kind of side caveat there. I don't want to damn all professionals who, I'm sure someone's gone, after seeing me and they're like, I don't know, he talked complexly about stuff. He didn't really help me, right? And people can oversimplify things. Not saying that I help everybody I see, but sometimes people kind of talk about it in a one-note way. So I think that's it. I feel like I could go further into these, but just kind of skimming the surface on these two unhelpful, if not destructive forms of therapy. If you're a provider, challenge yourself. Am I one of these providers? And do I need to kind of go through more training and develop a more robust method of interacting with my clients? If you're a consumer and you're running into these providers, then, question yourself. Are you missing anything that actually is going on? Could you have a conversation and ask about this? Or the worst case scenario, if you're really feeling stuck and they ain't budging, you've tried to kind of push them, maybe it's time for a change in providers. So, alrighty, well, as ever, thanks for listening and watching, and stay curious.